The current burden to the Uganda Cancer Institute has prompted the institute to lobby for partners to extend cancer treatment and services to the would-be potential consumers.
And then they decided also to put another support for helping create awareness and then also strengthened knowledge of community healthcare workers at the lower level.
The meager resources allocated to the health sector, particularly Uganda Cancer Institute, limits proportional services to the growing burden of service seekers.
And we have also developed tools or materials that can actually be used by health workers. So I would say we have trained now the entire country, the workforce at Health Center 3 level, and to some extent also Health Center 2. And they have the materials that they can use actually for doing their work. So for now, it's just a matter of mobilizing them, and that's why this training is also going to be very important.
Limited awareness and inadequate personnel at primary health centers have left many people unserved. The partnership between the Ministry of Health through Cancer Institute and stakeholders will facilitate community sensitization and detection.
Our project is actually aiming at training healthcare workers at those lower levels to be able to do the screening for breast cancer, so that when a patient comes into a health facility, you've come with malaria or a cough, or you brought your sick child, part of your interaction with a healthcare worker, they should be able to examine you for breast cancer. And if they suspect it, then you're able to receive a diagnosis.
The collaboration focuses only on breast cancer owing to its prevalence rate.
Strengthen their facilities and the health system, at the same time support the community awareness, so that you balance the both. You raise awareness, but you know your facility staff are ready to work to absorb them in terms of the services. Our biggest problem has been people need services, but the early detection services is not adequate for the level of their demand.
Inaccessibility of cancer services in remote areas and limited awareness has prompted victims into traditional healers and herbalists for remedies.
But they will seek services of herbalists because of diabetes, because I've told them it has no choice. They go to the hospital, and when they come here at the hospital, many times they keep paying the money in transport and other services that they require, or they don't get the treatment that they should be getting, and therefore they choose to go because somebody has convinced them that they are going to treat them. So
annually, the Uganda Cancer Institute registers 7,000 new cancer cases, and with establishment of regional centers, the number is expected to increase. Mariona Wari and Rogers Komagum for UBC.